Zone 2 should be done at a level of intensity where you could still maintain a conversation with someone. So how do you actually do Zone 2 training and find your own personal Zone 2? Well, at the beginning of the video, we mentioned Zone 2 is a form of steady state cardio done at a moderate intensity. And that steady state is important. You actually want to stay just within that Zone 2 throughout the duration of the exercise session. And that will give you the most physiological benefits and adaptations. Zone 2 should be done at a level of intensity where you could still maintain a conversation with someone. Not at this level of conversation, it needs to be more difficult than that. But if you were on the phone with someone while you were doing Zone 2 training, they could tell that you were exercising. They could tell that you were breathing more heavily, but you could still maintain the majority of that conversation. You might have to take a few breaths in between sentences, but you could get full sentences out. And the nice thing about this is it's actually fairly accurate when you compare it to laboratory testing, which we'll talk about some of those tests after we get to my least favorite method of checking for Zone 2. Just to reiterate, if you're just starting out with this Zone 2 training, that talk test is a really good place to start. I've actually done some nerdy testing on my own where I've run in Zone 2 while talking and just trying to see if I can stay in it with doing the talk test. And I've used my lactate meter alongside with it, and it actually is pretty close to that 2 millimoles. So good place to start. And then if you're using wearables with heart rate monitors, you can start to narrow in about that range of where your heart rate would be with your Zone 2.